This has been one of the worst experiences I personally have ever had in my life. And I can't thank you guys enough for one, creating this channel and giving us a space because nobody understood what I'm going through. They still don't understand what I'm going through. Not to be able to just walk at 20 weeks, not to be able to go up and down stairs, to be able to have my life back.
Let's talk knees, titanium knees, from hurting to healing to taking the lead. Let's talk knees.
Welcome, Camille.
Thank you, Dave.
Tell us a little bit about yourself and what led you to find out you needed to have your knee replaced.
Oh my God. Prior to July, because my surgery was July 3rd, prior to that, I rode my bike every day. I'm a full-time employee. I'm a regional manager for a staffing company. And I literally, about 6 months in, just had excruciating pain in my calf, that leg, but it was more of my calf. So end up going to see my primary doctor because I'm like, it got to be a blood clot. What else could it be? I couldn't sleep. I was having problems getting in and out of a car. It got to the point prior to the surgery, I couldn't even sit more than 5 minutes. I had to get a standing desk. I mean, it was the only thing that felt good was me riding my bike after work every day. And then to get off the bike, so it didn't hurt to pedal, but to get off the bike was just excruciating because it's almost like you can't even walk. You have to, get your balance, get yourself together. So went to see my primary care doctor and she scheduled me to have an ultrasound in my calf. It came back, nothing wrong with it. Nothing's there. And she said, I'm going to send you to Ortho Indy. And it was like, went to Ortho Indy, had an x-ray. And he was like, oh my God, you're bone on bone. You're all arthritis. And it was like, well, why is my calf burning? My knee don't hurt.
Yeah.
Because my knee did not hurt how, like you said, it was like, it was a burning, couldn't walk, couldn't get in our cars. My husband was constantly having to drive me around. I was getting to the point I couldn't drive anymore. And I have to get to work and I travel with my job. So I drive. And I go to Fort Wayne, which is 2 hours away.
I'm from Fort Wayne.
Oh, I know you're from Fort Wayne.
Sorry.
Yes, we have the office there. That falls in my region. And I have to pull over 20 times to get to Fort Wayne because I got to get out and stand. It's burning so bad. So met with Dr. Hood, told me that, and it was funny because he came in and was like, you're bone on bone. He was like, there's no need to give you any injection because it's not going to help because you're literally showing me the x-ray and I'm looking and I'm like, oh my God, how am I even walking? And my leg it's my right leg. It has started turning left. So on my x-ray, you literally see my leg this way.
Wow.
And I'm like, and he said, I promise you, because I sat there and I was just like, I don't want to do it. I don't even know anything about it. I've had a spinal fusion, 2007. I bounced back instantly, but I don't know. It was something I'm like, but I can't live like this. He said, I'll tell you this, by the end of the year, you won't be walking. And I'm like, what? I won't walk by the end of the year? And when you see that leg going to the left, I knew something, So he was like, your only option really is to have a knee replacement. And I was like, oh, okay. So I'm thinking, Cindy, it'll be a breeze. Oh, this is nothing. He was like, I'll have the nurse come in. He didn't tell me anything about it. He walked to the door. He said, I'll send her in. Let's get you scheduled, get that knocked out. You're in good health. You work out every day. You will bounce back instantly. I was like, really? That's what he said, Cindy. And I was like, oh, okay. He stopped at the door and said, now I'm going to let you know, you won't like me after the surgery, because you have to have strict, hard PT out the gate. And I was like, oh, okay. I'm still like, you just told me I'm in good shape. I'll bounce back. Okay. She came in, scheduled me for August. Yeah, August. No. She scheduled me for the beginning of July and I canceled it. It was like the 1st. And I ended up getting scared. I don't know why I got scared and I canceled it. But then one day I literally couldn't drive. And my husband was like, please get your schedule, please. And I was like, all right, yeah, you're right. Let me go. And I'm getting to the point now I can't ride my bike. Mm-hmm. So got it scheduled. It was July 3rd. They had not told me anything. I had not done any research, nothing. And then I found you guys and asked you guys prior to the surgery, and y'all sent me the questions to ask. And I wrote them on my chart. And they want to do a video call because they're like, we got you scheduled. And this is like 2 weeks before the actual surgery. And it was funny because he didn't like me asking the questions at all.
Yeah.
He didn't like it. And it was so obvious because I really thought I need to find another surgery. But I was in so much pain and dealing with so much. I didn't want to. I really liked him. I just didn't like how he asked when I came with the questions.
Uh-huh.
Do you use a tourniquet? He said, of course we use a tourniquet. You would bleed to death. And literally you had to see me on this video call. And I said, okay. And I just went down the list and he was not happy.
Wow.
I mean, he kind of had an attitude on every single question.
Wow.
Everyone. And when I first met with, when I met with him, I really liked him. We had really good, I just felt really comfortable. And I wasn't thinking, you don't have any questions to ask till I found you guys. I didn't know what to ask. I didn't really know how my life would change the way it has.
Yeah.
And I'm not an emotional person, but this surgery has taken me out. It's taken me out. I don't feel like I wonder, will I ever be the same?
Yeah.
I really feel like that. I still can't walk downstairs. I'm one hop, one. Going up is a struggle. And after the surgery, when you go in with questions and they don't answer your questions then either. It's like go to PT, push through, and keep going. And then after surgery, I had a setback.
Uh-oh.
So my right foot after surgery, my sister came down for a week, thank God. And they had me on the Oxycontin 5 milligram, which did absolutely nothing. But that, they had me on the ice machine. That was my pain medication. It really was.
Yeah.
I stopped taking those after 2 weeks. I don't even know if it was a whole 2 weeks. She had me on every 4 hours. You didn't get no relief, but what gave me my relief was the ice.
Ice. Yeah.
My husband lived. I mean, every day he's carrying big bags of ice in. I would see him in the window because I couldn't get downstairs. And it was like, oh my God. I mean, and that was my pain medication.
Yeah.
But it has really been a rough road. So right immediately after surgery, I didn't get to stay. And I literally had a panic attack when they got me up to walk up the stairs because I have 16 stairs in the house. I had a panic attack and they kept trying to push me to keep walking. And literally like I was on a schedule to get out.
Yeah.
And I couldn't believe it. I was not ready to go. I was crying. It was like, they can't let me go. I'm not ready. The room was spinning. I literally had a panic attack and they did not care at all.
Wow.
I've never seen anything like that.
That is too bad.
And it just went downhill to me from there as far as my care, because my right foot became numb and I had home PT for the first 30 days. So for 30 days, when they came in, my foot is numb. They didn't work on my knee at all. So I never was bending. They worked on my foot because I couldn't walk on the walker with my foot being numb.
Sure.
So then when I went and saw the PA for the first visit, the surgeon came in and he was pissed. I mean, he was mad. What do you mean they haven't bent your knee? You're going to have an MUA. This is ridiculous. Camille, do you realize what's going on? And I'm just like, I'm in so much pain. I'm just like, hold on. My foot is numb and I need to walk. I have to walk.
Right.
I can't even walk good with this walker. It was a mess. So they worked on that. And then he called. So now the home PT is done and now I'm going to outpatient. And he contacted them and really focused to tell them where my knee need to get. And I never could get to it. And I had an MUA September 11th, because my knee wouldn't bend at all.
Oh, wow.
At all. I barely could walk with the walker. I was falling with the walker. My husband took me out for the first time. I fell immediately over. No, bleeding from the other knee. It was like a mess. And had the MUA, and I still don't feel like it He claimed he had me. You know how they show you the picture, right?
Yeah.
But the next day, I couldn't bend my knee.
Yeah.
Could not bend it at all. And she gradually just kept working with me, kept working with me. And he had a cutoff time. And she said, we're not listening to that.
Good for
I'm
her.
going to help you. I've been working from home. I'm trying to go back in the office now. But if you sit too long, you're stiff and now you're like, you almost feel like you were before, but it's not the leg. It's that stiffness of that knee,
Mhm.
as you know. It almost feel like
Yeah.
that tight band is there. And I'm just, I just want my life back. And they don't want to hear that. They don't want to hear that. They want you to go to PT. I mean, that's all I kept hearing. Every my chart message from them. PT, 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 being. And nobody tells you that. Nobody prepares you for it. Nobody, when I think about it, I'm like, I felt so dumb. And even with answering my questions, I still wasn't prepared for what happened to me. What happened to me? I mean, it is just, I think I love one of your episodes, and I shared this with my sister. That word barbaric.
Yeah.
This is a barbaric surgery. Why is it emotional? I don't know because I feel like I don't have my life back.
Right.
And um, I'm pushing as hard as I can push
Yeah.
over and above. I bought a stationary bike. I'm doing everything. I feel like my quads. Thank God for Samantha. I've taken courses.
Oh, good.
And yes, thanks to you.
Oh,
Thanks to you. But it has been, and it's not even over. And I think that's the sad part because it's not over.
well, and
I still
it's
have to go.
scary. That's really scary to not know. Is it? Am I gonna get through it? Is it gonna get better? And all I can think, I'm emotional for you. That doctor told you if you don't have this surgery, you're not going to be walking by the end of the year. Well, guess what?
Here you are,
Thanks
not
to you,
walking.
I'm not walking now. And just my heart goes out to you. I'm so sorry. And I'm so sorry you're having to deal with all of this.
It is. It's and it's so funny because you don't want to share certain things. I would never share with coworkers and things because, right, my boss is like, "You're back at 100% because our corporate office is in Atlanta, so we don't see each other other than Zooms and things like that." And she's like, "You're back at 100. I can't wait to see you for the Christmas party at 100." Oh my God, my stability is horrible. I have I've been pulling away from the cane, but I still like it gave out in Kroger's the other day, and literally
Oh
I went
no.
down. Like I'm grabbing stuff, I'm having a good day, and I turned and literally fell instantly. I'm like, oh my God, I couldn't even believe it. And it's constantly that now. And the only thing I can think is my quads aren't strong. I just did the stiffness course that she had for free for 3 days. I mean, I'm doing I ride the bike every morning. I do my exercise before bed. I am relentless, and I'm still where I'm at, trying to push through. And I just feel like that's what I say. Will I ever be the same? Will
Have
I ever
you
be the person?
have you had since surgery? Have you had any X-rays? Have they did they
No.
do any X-rays?
So just that last where he released me, where she told me I had finally got zero flexion and I was bending at 115, and they released me and told me to keep going to PT.
Huh. So you were bending at 115 after the MUA?
That's what she said. I
And
don't believe it.
are you still are you still able to
Yes,
bend that
I'm
much?
able to bend. Mm-hmm.
Okay. So like you
Yep.
can sit in a
Yep.
chair and have your foot on the floor?
Yes.
Okay.
Yep.
Okay. I don't understand doctors that don't do x-rays. And
I
I
know.
and maybe that's because mine did an x-ray at 7 days post-op,
Mm-hmm.
and then my next appointment was at 6. So they did it at 7 days, and then the next one they were going to do is at 4 months. But when I went in again at 6 weeks, because they wanted to see me at 7 days and then at 6 weeks, I said I need to have an X-ray. I need the
Mm-hmm.
peace of mind that
Yeah.
everything's okay.
Yeah.
And so yeah, I don't understand that, and I just feel like I don't know. I mean, I've heard people say that when they've been in situations like this where they just feel like their doctor doesn't care, doesn't listen, you know, he's done his job, boom, your PT's problem
Yeah.
now.
Yep.
At that point, I feel like, and what these other people have done, they've gone and they've found another surgeon and
Yeah.
said help, and then he'll do x-rays, MRIs, and, you know, first thing to make sure, let's just make sure that the hardware's all in place, that everything is where it needs to be, and then we know, okay, we need to work on muscles and ligaments.
Mm-hmm. I
So
agree because it is. I could have never prepared for this, especially when you go and everybody's so nice and so caring and so polite and just you would just think. But that day they let me go during a panic attack, during major pain. You know, it was like okay. I almost feel like there was somebody. Like my sister was somebody outside the room where we like were
right,
another patient coming in. That's how it felt.
right,
Like it's time for you to go. And I didn't even walk up the stairs.
wow.
I mean, I got up one.
So you said that stairs are still really next to impossible for you. Is that because of pain or because of the inability to bend enough?
I can bend. It's like my quads still aren't working.
Okay.
And I really believe my quads are still asleep because I can come down, but it's almost like the leg, almost like you feel like it's disjointed,
Yeah.
like it's not. And I'm trying to trust this. I'm trying to trust that I trust it to an extent, right?
That's hard.
But when I come down, it don't feel good at
Right.
all, and it's not straight. It's almost like it's veering to the left.
Uh,
It's almost like it's veering to the left. And even when I'm on my stationary bike, I'm noticing that. So I've been playing with the seat height adjustment and things, and it's just still. Even though I can bend, I know I'm not at where you really should be
uh,
because when it close, because I can compare it to my good leg, right?
right.
And you can see when I still try to do the heel slides that I hate exist,
Yeah.
but they work,
Yeah.
right? But they
Yeah.
work, but I hate them. That was the one
Yep.
I'm still doing them. And but the mornings, oh my God, you just feel like that band is right there.
Yep. Yep.
You know, the question that he really hated to ask. That question he did not like.
The one about why the band? Why the
Yeah.
tightness?
When I
Yeah.
said, do you use a tourniquet?
Oh, oh,
And I
I
was
see.
so excited to have
So
your
you're
sheet
saying
right.
you feel like that, so the tight band is around your up around your thigh or around
Yep,
your
like
knee?
right around the knee, like at the top of the knee.
Oh, okay. Okay.
It feel like something is there,
Right.
like
Right.
just the stiffness, like
Yeah.
holding it.
Yeah.
Yeah,
Yeah. Because I think the tourniquet they put clear up like at the top of the thigh.
at the top.
Yeah. I mean,
Okay.
because that's where my bruising was. And that's what I've
Yep,
heard
me
from
too.
most people, that the tourniquet is
Yeah.
is pretty high up, you know, to the top of your thigh. Um, and I don't know about I can't tell you about the tight band, except that I've still got it, you know, and I
You
know that's
too.
probably not very encouraging, but
Okay.
I will be 10 months post-op at the end of this month, and I still
Yeah.
have that tight band, to the
Okay.
extent that once in a while I do feel like it almost feels like it's twisting my knee. And so
Right.
to me, that tells me that I wonder, is it my IT band? Because, you know, IT bands are like steel. I mean, it's hard to loosen those things up. And I know that the IT band like runs down the outside of the leg and comes down and kind of connects like under the kneecap somewhere, is my understanding. And so I just
Mhm.
wonder,
Mhm.
is it the IT band doing that? But it doesn't prevent me from being able to bend my knee. I still,
Right.
you
Yeah.
know, I can still bend it, but there's still that tight band. And I've heard people say it takes a year for that to go away. Some people say it took mine like 16, 18 months. So I'm still hopeful that that's going to go away. It doesn't stop me from doing anything,
Mhm.
just makes me very
Me
aware of
neither.
it, you know, and
It
it's
is.
super annoying. Is your physical therapist working on your quad muscle and working for
So I
that?
have so based off my insurance, I have 4 visits left. So she told me let's hold off on those. I haven't been in a month now, and just doing the exercises at home.
Okay.
Got the stationary bike, following the Samantha, because I don't feel like she really, I don't know. I have been telling her, but she was so busy following what he was saying and not to me focus on what I needed.
Gotcha.
right?
Right.
Because if that was the case, I think I would be further.
Right.
Her saying, so she told me it could take a year for my quads to wake up, and that's not an issue. But I can't get downstairs, and I have 16.
Wow.
It's a traditional house, right?
Right.
And she's like, it'll come.
Mm.
So if you go off of that,
Yeah.
now I know I can't go off of that, and I got to push and keep pushing. But stairs are still, and it does make me wonder, like, should I be going better up and downstairs by now? It just seemed like I should be. At 20 weeks,
Yeah.
I feel like I should be able to go up and down the regular way, not one foot at a time.
Right. Do you practice on them? Do you just like use the bottom step and work on it as part of your
Absolutely.
okay.
It's part of my exercise.
Okay.
Yes.
Okay.
Yep. Even at the very, when they first started me with the stairs at PT, they have you practice
Yeah.
doing those lower two, the
Right.
first two,
Right.
even going backwards, making
Yep.
sure you walk
Yes.
backwards. I don't, yeah, to walk backwards. It just have not. I almost feel like there's something wrong. Like, would I go back to that surgeon? I probably would not. I think I got to be honest. Even when the home PT was here, they were reaching out to the current surgeon. He never returned any of their calls to deal with
Oh,
my foot.
I'm so
He
sorry.
claimed that it was part of the, one of them nerves must have been aggravated from the surgery, and that it would heal. And I had to wait for it to heal. That healing time could be from 1 month to 1 year. And that was the staple answer given to me. And they literally gave me recommendations for surgeons that they worked with more than this when they was actually their first time being with Dr. Hood. And so I have those numbers and names, and I'm gonna give it. I want to be fair because you and I know I listen to you, and we know how it can take a year to get full healing. If you ever can get full healing, I don't even know. I don't feel like I'll ever get full healing because it's just something so off with this surgery. And I don't know what it is. No matter how hard I push and work, it's something off. And I don't know what it is. I know the x-ray I did see, it looked good in there. It was aligned. My knee wasn't going left. But when you walk downstairs, it's turning, it gears to the left. When I'm riding my bike, when I struggle, it gears to the left. And I don't know if that's just because I had been doing that for so long, prior.
Right. Right.
So I
What
just
about your
want to
foot?
be,
Yeah, you mentioned
I finally, so I had to go. So my primary care doctor ended up putting me on Celebrex, and that cleared my foot up a month and a half
oh,
later.
okay. Okay. That's
A
good.
month and a half later, I went to my primary care follow up, and thank God that they were willing to listen to me because he wasn't. He told me I just have to wait it out, for it to heal.
Right. Right. Well, and you said that you know, healing can take a year or whatever. And, so you have these names and numbers and, you're going to give it a little bit more time. And I wouldn't. For me, I
You
wouldn't.
would?
Camille, peace of mind is priceless. It's absolutely priceless. And and if you wait and then they go in and say the hardware's malaligned or the hardware's too big or it's too small or whatever, and the only way to rectify this is to start over, wouldn't you rather get that done now? Start over now instead
I
of
would.
waiting a month or two. And I'm
I
not
would.
saying that's going to happen, because the
Sure.
probably the most, I would say the most probability is that it's within the ligaments and the muscles and stuff, but for me, peace of mind is everything. And that's why I called them about my 6-week appointment. And I said, are you going to have me get an x-ray for this appointment? And they said, no, we don't require it for a 6-week. And I said, well, I do. I need it. I said, I need the peace of mind. I have this strange hardware in my body and I need to know it's where it's supposed to be. And she said, I absolutely understand. We'll order the x-ray. So I just think for me, I just would advocate for myself and say, I need to know, and I need to know right now. I need to make sure that I'm on the right track and, that what I'm doing is helping. Sorry, we have to switch
We
a
got a
dog
dog
out because
situation.
she's panting in my microphone. Anyways, that's,
I agree.
and I'm
Yeah,
not I'm not
you know
telling
what?
you, I don't want you to think that I'm
No,
telling you
I
or giving you
appreciate
medical
that.
advice.
Like,
I'm just saying that's what I would do
no,
for
I
me.
agree. Yeah, no, I agree. Because, like you said, I wanted to give it the benefit of the doubt. Like, you know, you almost feel like you're a burden, right?
Hmm.
I think because I've been treated like that
You've been
all this
treated like
time.
you're a burden. I feel like you've been treated like, you know, the surgeon did his job and his whole office, and then the surgical center, they did their job. They're done now. Your PT's
Yeah,
problem. So they keep saying PT, PT,
yep,
PT. And,
that
you
was
know,
always
it's possible that, you know, that maybe some of the problem is still coming from something that happened initially and needs to be taken care of from that point. So, you know, but I don't feel like going back to that surgeon is gonna help anything.
I don't
I
think
know that
so.
my surgeon, because one of the questions that I asked my surgeon's PA when I saw her at the 4 month visit, I asked her, I said, how often does Dr. Copper do revisions? And she was like, oh, I mean, like maybe 1%. She said he does revisions on other doctors' work,
Mhm.
but it's rare that he does one on his own because, you know, he doesn't have the problem
Right.
or whatever. So, you know, you definitely need to see an orthopedic surgeon that is willing to look at someone else's work, because some, you know, I think some might shy away from that. So I
Right.
would definitely ask that in your, you know, when you're first interviewing them. But
Because I think what I learned is that, and I looked at this doctor, I mean, he had excellent 5.0 Google reviews. He was excellent, but as long as nothing goes wrong.
yeah,
Hmm.
yeah, yeah,
They didn't deal with something going wrong. That's to me where my whole everything just kind of,
right.
I never seen him again. It was, you know, always with the PA.
Yep.
And when she released me, I was sitting there like, I looked at my husband and I said, I was like, did she
Released
just
from
release me
what? I mean,
from his care?
Yeah.
She said, I don't have to come and see him for a year, almost, no, 2 years actually. 2 years. 2 years. And I
That's
knew I
crazy.
was sitting there and cause she grabbed my leg up and she propped up. She said, oh, you're finally at a zero. Okay. Okay. And she set it down and I was sitting in the chair towards the edge. And she said, look at you. You can bend now. Okay. I think we won't need to see you for about 2 years. And I was like,
wow,
um, oh, okay.
wow.
Keep going with PT. And I was like, okay. I just, I, if I could do things over, I think I would scream a lot louder.
Mm.
Mm,
But I say that, but with knowing that the emotional roller coaster it have you in, and when you're right there with these people, sometimes even though you want to fight, you just so emotionally
oh
drained
yeah, I know. I get
that you
that.
can't, that you can't. And I think from the hospital, because I should have asked, wait, somebody who was ever like the upper management. I'm not ready to go.
Yeah,
I'm not ready.
yeah.
You know, what does this look like when I get home? Somebody tell me what I'm about to go through. And they got me out of there so fast. It was like, I couldn't believe it.
Wow.
So
Well,
when I hear
something
some of the stories of people today,
Yeah,
I'm excited for them.
yeah.
something that you don't. Another thing that nobody tells you going in is that surgical center is there to do that surgery, and they'll have
Absolutely.
8 of those. That one doctor might do half a dozen of these that morning, and it's just get you
Yes.
through, get you out the door. And we've talked to people who I was enlightened by it. If something goes wrong during that surgery, they will call 911 and take you to a hospital. They are there to do that surgery, and that is their entire
Oh,
purpose for being in that building, in that room that morning. If I'm wrong, somebody out there say, well, it wasn't like that for me. But for the majority that we've
Yeah.
talked to,
They're not a trauma center.
they're
They're
not.
not a hospital. They're a surgical center. They do surgery.
and
And
Have
you're
your
right.
surgery and get out.
They've got somebody behind you that he's got to get
yeah,
to that room and take care of that. It's not
because
an
I was his
excuse
first
for them.
morning. I was happy for that. It was funny because I was like, "Did you have a good night's sleep?" He was like, "Of course." It was just so, it was just odd. Like you said, now that I kind of sit back and I kind of like been documenting just everything
Good.
from when I got home, especially when I really started when I was dealing with the foot, because it was like I'll never be able to. I can't walk with an. I barely could get a shoe on it, so I could only have the shoe on for 20 minutes. And that shoe, when I had my first appointment, I had to take the shoe off because I'm like the numbness was hurting. It felt like needles.
Wow.
So mine felt like it was numb, but with these needles. And she was like, "Yeah, this never has happened to us before." And I was
Oh,
like,
great.
"What do we do?"
Yeah.
Yeah. And I was just looking at just surf everywhere because my whole thing for the first month was my foot. And
Wow.
then he just, but when he spazzed out on me about they had not
That's
bent in my
awful.
knee, he was like that. He said the foot will come when the foot come. Yeah, they should have been bending your knee. And then and when I mean, I must have cried all the way to the hospital that morning when my husband had taken me on September 11th for the MUA. But I knew I had to have it because I could not bend at all.
Yeah.
And I was trying. I never stopped trying. PT never stopped trying, but we could not get me to bend. I
Wow.
was at what 98. I was at 98 when they took me in,
Wow.
and we have been pushing. I would go between 86 to 98, but it would always go back to the lower number. I never got to 100 until after the MUA.
And you've
Wow.
stayed after the MUA, you've stayed at that number?
I've stayed.
That's
Well,
good.
not that I was at 100. So for the first week, she got me to 100 because it was right back stiff.
Uh,
Because I'm like, wait a minute, I thought he said he bent it to like 135. And after that, so it took us a week to get me to 100. And then the second week, I was at 105.
cool.
It was literally like 5 degrees each week.
Yeah.
And now I've been constantly, since I've been on the bike, she put me on the stationary bike at the center. Then I bought one for home. I'm pushing.
Uh-huh.
I'm pushing. So now I'm able to stay between the 130, 115 to 130. When you're stiff, you're not getting past 115. It's like you got to work hard to get to it.
Yeah.
It's a constant. And I'm just like, do that ever leave? But I don't think, even with watching some of the forums and listening to your guests, do we live with stiffness the rest of our life?
I hope
Like,
not.
how is it? I hope not neither, because I just want to wake up one morning and not have to do, I know I have to exercise. That's just part
Right.
of my life anyway.
Right.
But I exercise now before I can even get dressed because my knee is locked. It's
Oh.
stiff like a board. So I have to start with my heel slide, do my squats. I have to do all of that before getting in the shower
Wow.
to get moving. So
Wow.
I'm like, do that ever leave?
That
Because
that
I'm better
should
for the
absolutely
world.
leave. I mean, you should absolutely not have to deal with that. That's
Okay.
not normal. I mean, it's
Okay.
not, you know. I mean, I get up in the morning, get up during the night to go to the bathroom, I swing my legs out of bed and I get up and walk. I mean, I still have to tell myself in my mind, you don't have to limp. You can put all your weight on it. It's
Yeah,
fine.
I mean,
Because that
yeah.
tightness that I still feel makes me very aware of my knee. You know, most
Right.
people, they just, like I tell Dee all the time, look at you just walking around with your normal knees, like you don't even know they're there,
Don't
but
worry, I tell my husband that too. Boy, you sure walking good.
right, right. And, but that tightness makes your brain always be thinking about that knee.
Always.
But
Yeah.
yeah, the fact that, it's like, and that's the thing, there's a difference between stiffness and tightness. It's tight, but
Right.
it still bends.
It still
But
bends.
stiff, if you're not able to make it bend because it's stiff and you have to work, that's not at 20 weeks. I mean, maybe at 4 and
But
5
I have to
weeks.
work. I have to work in the mornings. Now after that, I'm good. So after that, I get up, get going, working, no problem. Going from warehouse to warehouse, I'm working, right? But at night, and then once you relax, it's like stiff, and I gotta get up, and I'm like, oh God. And then, but once it's going, it's good. But it's that Once it's settled, it don't like to settle right now at 20 weeks.
And what's your pain like? I mean, is there always pain? Like right now, are you having pain in your knee?
No, so it's not like pain, how
Okay.
you mentioned. So it's not pain. Like I don't have any, my leg is good. So
Okay.
I know why I got here because of where I came from, right? I don't have that,
Okay.
but I'm dealing with that stiffness
Okay.
and that tight feeling. You
Okay.
know, that lock, almost like it's locked, and then
Right.
you got to get going, and
Right.
then you're good.
And
But no,
when you stand on it, when you if you can
but
you
wait a second. I do get a couple of zingers every
zing.
now and then.
Yeah. Yeah. Where
I
are
learned
they?
to work from you.
Where are the
Oh,
zingers?
that
Yeah.
kneecap.
Yeah.
And my husband go back to doing, we have to go back to the old days, right? 20 weeks ago, and he do that massaging.
Uh-huh. Uh-huh.
And it really helps.
Yeah.
It really helps. But I'm like, should I still have to do this in 20 weeks? His fingers are getting tired.
It's good for him. Oh, his poor fingers,
I know,
right?
Cindy, you know.
Yep.
And
Yep.
he be doing this to me. This how my hand gonna be by the time you heal all the way. I'm like, oh my
So have you got your scar really, really loose and
yes.
moving? Okay. And
Scar's good.
what about the skin all around the knee? I mean, have you really
It's
worked that?
good.
It's
Yes.
good. Okay.
That's
Okay.
good. That's why it's being so tight and stiff. Still like, wow, I got so many pluses, but that one negative make you don't even look at the pluses because the negative one, I just want to get up. Like when I get up from here, it's gonna take a minute, right? Because it's gonna be locked,
Hmm.
and I can't just get up, hop down, and walk. I'm
Right.
going to have to stand up slowly, and then I'm still dealing with this the lack of stability, like just not. I don't know what that is, but it is like, and I think you gave me my answer what I needed today. I needed somebody like you, and I appreciate it, to tell me that I need to go see somebody just to make sure I'm okay.
Yeah.
Because there are things that to me are not okay, and I really should be calling the surgeons you would think that perform this to say, but he's going to tell me
Yeah.
I'm good and I need
Yes.
to wait.
Yeah.
He's going to tell me that. There's no doubt in my mind, and I don't want to hear it.
Right.
I need to know, what do I do? Because I'm doing all the exercises. I'm doing everything in my ability to get where I thought I should be at. I hear people at 20 weeks and life is good again.
Mm-hmm.
Yeah.
My life isn't good yet.
Right.
I'm still like fighting for my life,
Right.
fighting like daily. We
Right.
have a trip coming up for Christmas. I am terrified, guys, of the airport
Yeah.
because my husband's not going. And I'm worried walking to a plane. I'm terrified. Like how, and I don't want to be in a wheelchair. I'm not handicapped.
Right.
I'm 50, not 84. I don't want to be in a wheelchair. I want to walk, but I know right now, I just fell in Kroger's last week
Yeah.
and I'm catching myself every day throughout the day. I have to catch. I can't just walk straight. It's
I
like a lean.
I get it. I understand. I hated the walker. It made me feel like an old lady.
Me
I hated the
too.
cane, but I didn't want to fall.
I didn't want to fall.
And so, I mean, I say this is a time where you kind of have to, eat a little bit of humble pie and say, I'm either going to take a walker or I'm going to take a cane or I'm going to ride and have somebody push me in a wheelchair. It's not worth falling. It's not worth it, Camille. You need to be able to go on this trip and have as good of a time as you possibly can and not fall and hurt yourself even more. So, I would say one of those, and maybe, maybe I don't know if a cane is enough to help you to prevent you from falling, but I would just, that's what I would do. And that's why I stayed on the walker so long. I mean, 5 weeks seemed really long when everybody else was saying, oh, I used the walker
I
for 2
know.
days, and
2 days. Oh, I see those people with the
yeah,
2 days. And I'm like, good for you, because baby, that was not mine.
right,
That's not what
right.
I had it for.
Right. I did not want to fall. And so I was like, I don't care. Judge me if you want. I'm staying on the walker. And then I used the cane for another several weeks
Right.
after that, So
You have to pull it back out. I know. I was just hoping,
bling it
like,
up. make it all blingy, put some sequins or something on it. Make it cute.
A couple of bells and some
Yeah.
streamers.
Yeah. Decorate it for Christmas.
There you go.
I
There you go.
will.
Flashy
I
lights.
will.
Do it.
Because it's like this has been, my sister's like, if you survive this, you deserve this cruise more than anybody that's going. You deserve it
Absolutely.
more than anybody.
Absolutely.
You survived, and I am surviving, but it's still so. I'm just so terrified because I thought I would be like running. I can't run. I
Yeah.
tried in my office the other day. I just want to see, can I? That knee will not run.
No.
It's not running. I just want to see, can I run in place? It won't
Yeah.
run.
I haven't tried
Yeah.
that. I don't even, of course, I don't like running. So
Right. I'm not a running either. I just want to see, like, what can I do? I want to do something different, but it's not ready for that. I have, I know you talk about kneeling. So I'm like, I was watching one episode, I said, let me try. I haven't even tried to kneel.
don't.
I got a pillow. I knew you were going to say that. I got a pillow on the bed, and I just wanted to make sure it could touch on something, and it
Yeah.
did.
Okay.
It just feel weird, like super weird.
Yeah. No.
I was able to do it.
I'm like, I'm perfectly okay if I live the rest of my life and never kneel again.
And never kneel again.
I can get down and look and find something under the couch if I have to. I can get down on one knee, but I can leave that up.
Yeah.
I'll get down in the yoga downward dog position, and so
Yeah.
that I'm not kneeling, but I can get my face down on the floor like under something if I have to, because I just always have that thing in my mind that I don't want to risk anything. And
Right.
when I was
Right.
still on one of those Facebook forums that terrified me, somebody
Yes.
posted about kneeling, and he
Mhm.
knelt, at like 2 or 3 months, he knelt and he said, now I'm having so much pain in my knee. Does anybody have any experience with this? And everybody was saying, my doctor said, don't even think about
Yeah.
kneeling until at least 6 months. And I'm like, I'm just not going to kneel.
I'm just not gonna do it.
Right.
I'm taking a chance, right? I
I
only did it one time.
mean, when I heard the doctor say that, when you consider a normal, good, healthy knee, like our husbands have, a 10, and
Mhm.
and the knee that we had before surgery was maybe a 2 or a 3 or whatever, and we wanted it to be better,
Yeah.
we thought that we were going to come out with a 10, but then
Right.
I found out that no, if they can get you to a 7, boy, that's twice as good as the 3.5 or
Twice.
whatever.
Exactly.
Don't
Right.
make me do math, but
Right.
and so this knee is never going to be like it was when we were 16.
Correct.
It's never going to
Right.
be like that, but it shouldn't have pain in it, and we should be able to walk, we should be able to sit
Right.
down and stand up and go up and down stairs and
Yes.
ride a bike
Drive a car.
and drive a
Yeah.
car and do all those daily things that we need to do.
Right.
And I just feel like, and I don't want you to think that I'm at all saying something's wrong, go get it checked.
I don't think that. No,
But
I appreciate it. Yeah.
but
Yeah.
I just want for you to find a surgeon that cares and says,
Yeah.
okay, let's see where this is coming from. Let's order an x-ray. And if that doesn't tell us, then let's get an MRI and let's make sure, because we don't know what that other surgeon did in there. I did recently watch a video of a gal that I follow because she does pottery, and she happened to have a knee surgery. Not a total knee replacement, but she did have a pretty big knee surgery. And she calls it a botched surgery because they cut both of the ligaments that are on either side of the knee, which are the stabilizer ligaments. And I'm sorry, I don't know the medical name for them, but there's these stabilizer ligaments on each side.
Oh.
And this doctor cut those. And so now her knee just,
Oh.
it buckles and falls all over the place.
Oh.
And that never should have been done. I found out after having surgery that it's typical in a total knee replacement that they cut or remove the ACL.
Wow.
We don't need that anymore because now we have this hardware. Well, apparently there's a team ACL and team PCL, because you got your ACL and your PCL that kind of cross, I guess, like behind your knee. I don't know. Don't quote me on that. But anyways, most of them, a lot of them, they leave the PCL because it still does something. But Dr. Rosen, who I really like on YouTube,
Oh, I do too. Because
love
of you.
him.
Thank you.
And I was
Thank
just watching one of his videos recently where he talked about the ACL and the PCL and how I think it's on the East Coast they
Mhm.
remove the PCL. On the West
Mhm.
Coast they don't remove it. And
I've seen
so
that episode.
yeah,
Mhm.
yeah. So,
Mhm.
again, it's like it just seems like a total knee replacement should be the same no matter who does it. But we hear from all these different people that different things take place by different
Right.
surgeons. So
I really learned that from your guests.
yeah, yeah,
Nobody's is the same.
Yeah.
None of ours is
yeah.
the same.
So different.
None of us are giving the same information.
Yep.
I mean, one of your last guest, I think she was the one that was talking about ice. I haven't really been using any ice.
Yeah, yeah.
And I'm like, oh my God, I wouldn't even be sitting here today without the ice.
Right, right. I know. It's crazy how different it is. It's crazy how different it is from surgeon to surgeon and from, recovery to recovery, whatever. But you may go in, you're going to find a surgeon that you feel really good about, and if you have to go to two or three different ones to find the one that you feel like this guy cares and he wants to help me,
Yeah.
even if that means all he does is, an x-ray, or, maybe he does an x-ray and an MRI, or, one or the other. And he says, everything is good. I don't see any problems with this. What I think is going on is, there's ligament issues or your quad or whatever, then, that's going to just
Like,
boost you up and
Yeah.
say, okay, now I know
yeah.
what I know what I need to work on, and I know what I can do to get to where I want to be.
And I know
So,
nothing's wrong.
right. And just
Yeah.
that
Right.
knowing, that peace of
Right.
mind. I mean, and
'Cause
that's just
I definitely don't have that. And it's so, it's like at first I was like scared to even kind of tell my husband the way I was feeling and the not being
right.
stable when he's not around. And I'm like, I can't keep living. I finally was
Yeah.
telling him, look, I am still not where I need to be at.
Yeah.
Because I think even in his eyes, at a certain, point that he just thought based on what we have been told, 6 weeks, I was going to be off to the races.
Yeah.
Right.
That age, really,
Yeah.
that's how they prepare you. He's like, you're young, you're healthy, you'll bounce back. And I really thought that. No,
Mm-mm.
no.
No, I wasn't even putting on makeup for, I don't know, 2 or 3 months at least.
Oh yeah, I couldn't even get. I mean, I never came down. The first month, I never came back downstairs. I couldn't get down the stairs. I was terrified.
Yeah.
And you said I would just sit up. I had to make sure I could. I was feeling bad. My sister and everybody cleaned my cat litter. They know I live a certain cat. Everything. He's not going in there if there's already a pee in there, right? It has to be clean. And they like, what? So I would get over to his room to make sure
Mhm.
things are in the line, but I couldn't bend down. But it was like, I'm gonna figure this out. And I figured it out, right?
Yeah.
But I would love a peace of mind.
Yeah.
And I do think that's why I love just the recommendations of who you follow and who I've been following, because I do believe strength is going to play a role, but I still believe my quads are asleep. And why would they be asleep this long?
Yeah.
With
Yeah.
everything that I'm doing, I still feel like something is wrong, missing something.
And if that's nerve damage, because
Mhm.
I know I've heard a lot of people say the tourniquet can cause nerve damage, obviously in the thigh, in the quad, well then, okay, what do we do to help repair that?
Right. Well, Cindy, and think about it. I already had, so the nerve that they were telling me that made my foot numb is
Mhm.
called the peroneal nerve.
Okay.
And that's the nerve that runs down through your knee all the way down to your foot. So if that nerve got damaged, because could another one be causing me
Right.
the issue that I'm
Right.
having?
Right. Yeah.
And I have been thinking about that.
Yeah.
Like, that's why I would love for him to care and
Yeah.
say, we need to do other x-rays,
Yeah.
make sure all the nerves are in line.
Yeah, but he's not going to care, because to me he sounds like, unfortunately there are those surgeons out there that when you come in and say something's wrong, he's offended. You have just
Yes.
insulted his work.
Yes.
And so unfortunately,
And he's younger too. So
uh,
he definitely feel like that. Very
Yeah.
cocky.
Yeah.
He's done some coach football players, but again, all that I recognize now, because I done went back through the 5 stars over and over, and
Right.
it's because everything went right. But when something goes wrong,
Yeah.
they don't want to hear that.
Yeah.
Yeah.
And that's the issue.
Yeah.
And I'm like, I don't want to be the 1%, because she's like, you're like 1% with this nerve with my foot. She's like, they had not seen that before. I'm like, ever?
Wow.
How many surgeries have you done?
Yeah.
But this after the fact, I believe he did a good job, but I'm having issues.
Mm-hmm.
And it's not to the lack of what I'm not doing, because I'm a fighter.
Yeah.
I fight. I'm pushing myself to the very end.
Right.
Whatever it is, I'm going to do it. I
Right.
don't want to be in a wheelchair, can't walk. That's not
Absolutely.
even my lifestyle.
Absolutely.
We're active. We like to get out. I love the stationary bike, but I do see where my limitations are. And
Sure.
I want to be able, like right now, I'm already dreading getting off with you guys and having to go take all my equipment back upstairs to my office, right?
Oh,
Because I don't want to go up the stairs.
yeah. I
And I
get it.
definitely don't want to come down the stairs.
Yeah.
So, yeah.
I get it.
Awesome.
Well, and I don't know, if it's any comfort or whatever. I mean, we have two little steps inside our
Mhm.
house. To go
Right.
out back, it's what, 4 steps, and out front, it's 4 or 5 steps. And I don't love them. I mean, it's a big difference when I step on my surgical leg to go up. I feel it. It doesn't hurt, but
Right.
it's not like stepping on the other one where it's like just you just
Mhm.
walk up or you just step down. And then of course going down, I step down with the non-surgical leg, and that surgical leg just it has to bend a certain way to come
Mhm.
down off of that step, and I'm aware of that. It's
Right.
not, I'm not just, supermodeling it up and down the stairs. I'm not, but I feel like at 20 weeks, you should be a little bit farther along. And maybe that's
Yeah.
going to come because, I feel like I'm a slow healer. And so maybe it's going to take you 6 months to be really,
Right.
feeling really
Cool.
good about the stairs. But
Right.
I just feel really strongly that, let's just find out. Let's just find out. Let's get that peace of mind. And, you're not a burden. Okay. You are not a burden to anybody. Don't feel that way. You need to advocate for yourself, and you need to advocate for your life. And, this is my life. I
Yeah.
want it back. And
I
if
want
you're
it back.
not willing to figure this out, I'll go find someone else. Thanks for your time. So
Yeah.
I really encourage you to do that.
Thank you.
So who
You
are we going
guys,
to call tomorrow, Camille? Who are we going to call?
I'm going to go through my list today, because you gave me 4 good names
Okay.
that they work with,
All
and
right.
they believe in. They've been keeping in touch with me.
Okay.
The home PT people.
Nice.
That's good.
Nobody else they have. It's
Yeah.
so weird. They'll text, hey, how's your foot? What can we do? What did your surgeon say? We've left them all these messages. After they released me, they were still reaching out to him.
Wow.
And he
Wow.
told me he received messages from them, but what they didn't understand is the nerve had to heal, and it could take up to a year. So there was no need for him to call them back,
Wow.
is what he wrote me in my chart.
Wow.
Yeah, he'll write me in a minute. He
I-
got in my chart.
I guess I kind of feel like, okay, you say it's the nerve and it needs to heal. Prove it. Let me see an MRI. Show me on an MRI. I'm assuming things like that. I know soft tissue things and stuff show up on MRIs, but I just kind
Right.
of feel like, don't just tell me. I need the proof. I need to see it. I need to make sure. So,
You know what, Cindy? I always was thinking while I've been going through this, I was like, is that why they always tell you be old when you get this done? Because the old people don't ask no questions. Because I'm like, normally you hear the knee replacements normally 75, 80.
yeah.
Older people maybe not as active. And I'm like, yeah, because they probably didn't ask you no questions. They're not moving around as much, it heal. And I'm like, I've been feeling like that through this whole process. Like, they make you fearful to ask a question, right?
Yeah.
Because
And-
you feel dumb.
Right.
You almost feel like you're inconvenienced. And he already told you need a year.
Right.
Call me in a year.
Yeah.
And I feel like, yeah, I don't want to wait that long. Thank you. Thank you.
You're welcome. And I feel like my understanding is a lot of times the recommendation is to just wait as long as you can because of the lifetime of the hardware. You don't want to do this
Right.
again. I'm like, heck no, I don't want to do this again. So I mean, I was 61 when I had mine done, and I'm hoping, I'm thinking if I can get 30 years out of it, that might be good.
I'll be
35.
good.
Let's go with
Let's go
35
35.
years.
What's the warranty
High
on those?
number.
Yeah.
But I know people that have, had it done, years and years and years ago, and it's still just absolutely fine. So, but
Yeah.
anyways, well, Camille,
I can already answer this question for y'all. I will never get this done to my left. I told my husband, I would never, ever, even though I recognize I don't have the pain I had prior,
mhm,
I would never, ever. I am doing everything to love on this girl right here
Mm-hmm.
mhm,
and make her, and that's why I don't like this one step at a time. I'm put so much of my weight on the left.
mhm,
And we know the damage that can cause.
mhm.
And that's what I'm more fearful for because I'm babying her to death, right? Like we never going over here.
Yeah.
No, we'd never do it again.
Yeah.
Nope.
No, I hear you. I hear you. That's what I've told mine. Just, hang in there because we're not doing
Hang
this.
in there. Yep.
Once is enough for me.
Me
Before
too.
we start wrapping this up, I want to give you the opportunity to call out your caregiver there, your personal knee masseur.
Yeah. So first shout out to my sister. She drove down here, stayed a week with me, and like clockwork, 4 hours, she was in that room. Okay. And with that ice. And then my husband, he's been amazing. Oh my God, thank God. And then
Oh,
my nephew lives here in Indianapolis with his wife. He was one phone call away. He was popping up on me to make sure I was okay. His wife. So I really appreciate my team.
that's
Nice.
awesome.
They were really good to me.
That's wonderful.
And I wish I could be at 100% for them right now,
Right.
but I'm not. I'm not. But I'm trying, guys. I'm trying.
I know you are.
I'm trying.
And
I
I feel like you're going to get there, but
thank you.
you might need to do some things along the way and
Yeah.
make sure you're doing everything that you can do to get there. So,
Yep.
anyways,
I am. I
Camille, thank
will.
you so much for being so willing to share
Thank
your
you.
story. We
Thank you.
really appreciate it, and I know there's going to be people out there that are saying finally somebody that's saying what I've been worrying about and thinking about. So I know there's going to be people out there because none of us are alone in this. We
Yeah.
can find other people that relate to our story and have been through it. So I know that your story is
That's
going
why
to
I'm
help other
so
people.
grateful for you guys. Thank you. I mean, because you guys really, I mean, when I watched yours, I was like, oh my God. But when you look at other foreign, people are just so bouncing around and life is good and one day, 1 week, but to have a real person saying what they're really going through and then to create this channel. Thank both of you because this
Oh,
is amazing, right? That real people, whether it's good or bad, because there's good. I got a lot of good, but I still have a journey to get through.
right.
So I don't want everybody to think I'm just poo-pooing it totally. It's not that. But as you've said, they don't give you the information at the beginning because maybe I would have waited a little long. I don't know. I would have had a decision to make, but at least they would have given me all the information and they gave me none. They were
Right.
like, you're young and you'll pounce through it instantly. So thank you for sharing your story and then be willing enough to keep this going and giving us an opportunity to speak to everybody too. So thank you indeed because you guys are amazing.
No, thank you. That means a lot to us. And we want you to keep in touch and let
I
us know.
will.
Let us know what happens when you
Yeah.
find that surgeon that you're going to go see. Yeah, let us
Okay.
know because if you get any kind of information before this video actually goes out,
Okay.
we can throw a little blurb on there to
We sure
say,
can.
what happened and what you found
Okay.
out or whatever. So be sure and stay in
I
touch with us,
will.
Camille. Thank you so
I
much. We
will.
really appreciate it. It was lovely to
Thank
meet
you,
you.
guys.
All right.
Thank you.
Bye. That one
That one got you
me.
right in the feels, didn't it?
That one got me right in the
Yeah.
feels. Man, my heart just goes out to her. 20 weeks and still such a struggle, and then just the way the surgeon has just thrown her away. That is so wrong. That is so wrong. And I know that there are surgeons out there that don't do that,
There are. Your surgeon was fantastic. even to talk to.
I mean, I haven't seen him again.
You haven't.
You know, we did talk to him that next
We
day
did.
because he happened to be the on-call surgeon when we needed somebody. But I'm just, my heart just goes out to her, and you know, I couldn't not express to her how I felt the importance of peace of mind.
Yeah.
You know, don't wait. Don't give it any more time. My goodness, it's been 4 months, you know? And like I said, even if they say everything looks great, you just need to work on this or this. Okay. You
And
know?
I will. Yeah, right off the bat, with her asking the question, you know, are you going to use a tourniquet? Well, of course I'm going to use a tourniquet.
Yeah. Yeah.
Arrogance.
Yeah. Very,
Wow.
very arrogant. And it's sad. It's sad that there are surgeons out there who take people coming to them and saying, I think something's wrong, as an insult and
Right.
as an offense. But they do. And it's not, you know, we're not trying to insult you. We just want to know that this is okay. So anyway, I can't wait to hear from her.
Right.
After she, you know, gets it checked.
That's another one we'd love to do a follow-up on.
Yeah, for sure.
And
so
I, as we were going through this, I was thinking, wouldn't it be great if we couldn't do this channel because everybody had such a good recovery,
right.
and there was nothing to talk about?
Right.
Obviously,
if it was just all rainbows and butterflies and everybody just breezes through it and they're out on the golf course in 3.5 weeks.
I'm sure most do.
A lot do.
That's what we hear. But a lot don't. And if you're one of those, we'd love to hear from you. Reach out to us, hello@totalkneetalk.com, and tell us your story. Tell this community your story. There are a lot of people who really need to hear it. Whatever that story may be, somebody is really going to relate.
And if you're sitting there thinking, well, yeah, I had total knee replacement, but you know, in 8 weeks I was fine and back out on the golf course and I didn't have any problems. Nobody wants to hear that. No, we want to hear that, because you know what? We need hope that there are good outcomes to this, and that, you know, maybe even though some of us are slow healers, but we're going to get to where you are. And, you know, even though you got there a lot faster, we love those stories. So, you know, please reach out to us and let us know. We want to hear stories no matter where they are on the spectrum.
And chances are, you know, somebody who could use these stories. So please share the videos, share the Total Knee Talk YouTube with them. And good grief, if there's somebody you know that's going through this, reach out and lift those people up. They need it. Especially if they've had a doctor experience like Camille has.
Yeah.
Where she's been made to feel like she's a burden.
Yeah. And I still think back to, and I know I said it in one of our update videos, that when my dad had total knee replacement and he was like 72 years old, he lived in Indiana, I lived in Arizona. I didn't call him. I didn't ask him how he was doing. I didn't ask him how it went. I didn't know. I just, you know, you just hear people have knee replacement. Oh, it must be fine. It's not. If you know somebody that's had knee replacement or anything, give them a call, send them a card,
make them a pie,
take them a pie, because it does mean the world to them. So
we appreciate your support watching this video. If you take that a step further, give us a thumbs up and subscribe. That really helps the channel. It gets the word out when we are trying to spread the word that you are not alone in this. And for heaven's sake, if you are going through this, you are not a burden. You deserve to know what's going on with your body.
Absolutely.
You deserve to have somebody tell you everything's okay. It's going to be okay. Or, oh, we found this. We can fix that. So don't go through it alone. Be easy on yourself. Give yourself some grace. Cut yourself some slack.
And remember that this is your recovery. You are in charge.
Let's talk knees, titanium knees. From hurting to healing, to taking the lead. Let's talk knees. So next time someone brings up knees, don't just nod, lean in with ease. There's a saga in those joints, a battle fought, a new way to move, a lesson taught. Full range in 6 months, that's the move. Let's talk knees. Yeah, knees.
How do you not see that? I didn't see it this time either, but
Well, I won't.
I wasn't looking at
I won't
me.
make us start over.
Okay.
Okay.
I
But
wasn't looking at me.